so like prenatal vitamins are like designed, like it makes it really easy to get the stuff that you need because they're like somebody's thought it through. And so I buy prenatals, I take a B complex, I take vitamin C, and that makes it real easy. And I'll take some zinc maybe a couple times a week and some coenzyme Q. But that really helps a lot. And I'm 54 years old and I work out and I can run and I do everything that I want to do, and I don't really have physical limitations, other than my total fear of, death from jumping out of an airplane. But other than that, I'm good. I can swim and do all the things, and I have some, joint aches from all the rugby I played. But I find that if you do those things, and if you do get those joint aches, then look at whether some glucosamine is good for you. Like, but be smart. Don't like the over supplementation can really make you sick. And I've seen that, and I've seen it in a lot of I have a humongous practice of fitness models, like my breast augmentation and breast reconstruction and breast redo practice has gotten into the fitness community. And so I have a lot of these like very major league Instagram, fitness models that come into me to give them cleavage because they're so thin and they're like, oh, my breast implants are too wide apart and, they're under the muscle and I need them to do this. And so I learn about their physiology by operating on them. Yeah. And I think that, they too feel that supplements are important, but, a lot of them have supplement lines. I can, if you go on my Instagram, you'll see all these folks and you can kind of look at their stuff. But, and I don't endorse any one over the other, but I have bought some of their products and they're good. They've thought it through and they work out like crazy and they look like that. So people go, well, I want to look like that. I better take these supplements, but just don't take everything.
Don't over supplement. Like here with Invigor Medical, we have a doctor call you. They only give you this a certain amount per week. It's very, critical and like everything's set out for you. It's already pre-dosed and everything. So you get the instructions, you get once a week, whether it be Wegovy shot or Sermorelin or whatever you take. It's all broken down for you. So you can't, you could if you legitimately overdosed yourself, but it's set up so you can't.
Right. And that's key. You need that guidance, and that's how you should do it. And if you can, be clear about your goals. This is really important. If you're going to supplement your, your workout, your workout regimen, or like I'm training to do a marathon, or I'm trying to lose weight, like that's when you want to get guidance on that, and you want to go to an expert because you need somebody to evaluate where you are and where you're trying to go. And then you can come up with those programs, because again, if you try to do it on it's like anything, you try to do it on your own and without guidance, you're going to be really disappointed in the results. But I find the supplements are key and they're important. I've taken supplements since I was probably, in high school, and it's made a difference, I'm sure.